How can we make the world better? By making ourselves better. The Dr. Joe Show explores how you can make positive personal change by using his groundbreaking and highly effective I Am approach to understand who we are and why we do what we do. Your small changes can have big effects.
Join us now for the Dr. Joe Show with Mark Stiles of Stiles Law, Thomas McCoy, and your host, Dr. Joe Schrand.
Ladies and gentlemen, welcome to the Dr. Joe Show.
Nice to have you back, Mark. Ladies and gentlemen, and everyone else, men, women, them, they, the whole gamut, welcome to the Dr. Joe Show. Mark, how have you been? I haven't seen you in a while.
No, you haven't seen me in a while. It's I've been great. I've been tremendous, actually, Dr. Joe. Thank you for asking. Thursdays haven't been all that convenient for me the last couple of months, but we're here. We have an amazing show, which I'm really excited to get right into.
Well, why don't we do that? Mark, could you introduce our guest for tonight, please?
I would love to do that. Dr. Maurizio Fava is with us, and he is the psychiatrist in chief, the Department of Psychiatry at Mass General Hospital. Dr. Fava is a world leader in the field of depression. He has authored or co-authored more than 800 original articles published in medical journals with international circulation, edited 8 books, and published more than 50 chapters and over 600 abstracts. Dr. Fava is editor-in-chief of Mass General's Mind, Mood, and Memory. Welcome to the show, Dr. Fava.
Thank you. It's a pleasure to be here this evening.
It is so wonderful. I'm so honored. Just so people know, I did my child psychiatry fellowship at MGH McLean many years ago. Dr. Fava was already there. We passed in the hallway, but I am just truly honored that you would take the time to come and talk with us tonight about such an important topic. Thank you for being here. We're going to be talking about COVID and depression. So, Dr. Fava, where do we start with this?
Well, I think we can start with the data, if you wish, with the fact that, unfortunately, we have seen a tripling of the rates of depression across the country. And these changes, if you wish, have been particularly significant in the younger population. We've seen a tremendous escalation of the number of kids with depression, young adults, and we have wondered, how can it be? Why are we seeing this tremendous increase in the rates of depression? And what are the contributing factors? Now, one you could argue is just the tremendous stress that COVID-19 has caused to the general population. The fear of dying, the fear of, contracting the illness and dying, or the fear of your loved ones getting sick and dying. So that alone is a significant stress. You add to that the fact that the pandemic has caused social isolation. If you remember, we went through weeks where people were hesitant to go to the supermarket. They were hesitant to go out of the house. And that that level of isolation clearly has a significant impact on mental health. In fact, it's very interesting that if you remember, in China, they had a zero COVID policy. In some ways, they tried to eradicate the illness through major lockdowns. And, those lockdowns did work in China initially, but now with the Omicron variant, they don't seem to be able to contain with lockdowns. And so the lockdowns become prolonged lockdowns, not 2 weeks or 3 weeks of being locked down in your apartment or your house or wherever you live. But now you're talking a more chronic lockdown. And we're seeing that China is now overwhelmed with mental health requests for treatment and they're just not equipped. They just don't have the resources, and it's becoming, delayed compared to us. But we see in China the pandemic within the pandemic of mental health issues within the pandemic. But we saw it much earlier because we had the stress and the lockdown early on, and we clearly have seen that.
I'm just curious, what is the connection then between the anxiety and the fear that we have about contracting the disease and our loved ones dying and depression? Is this part of the fight, flight, freeze response that we have as humans trying to survive?
Well, first of all, depression, we use the term depression, but, there are many forms of depression. One common form is what we call anxious depression, or depression with anxious features, where you're down in the dumps, you're feeling sad, you have low energy, you have to push yourself to do things, but you're also at the same time very agitated and worrying and really, kind of unable to relax. And that type of anxious depression is quite common. But even if you don't have an anxious depression, anxiety, fear, chronic anxiety can bring about depression as a consequence of the stress of the anxiety. So anxiety can be by itself a risk factor for depression and can become part of the depressive, syndrome, if you wish, once you get depressed. So it does make sense that chronic anxiety and chronic stress due to fear may be a contributing factor.
And why so much more, do you think, in the teens and the young adults?
Well, if again, we don't know why, but if you ask me to speculate,
yes, please speculate.
Why? Young people, in my mind, are very much typically part of a network, a social network. In school, they're highly, in some ways, interdigitating with other peers. And so if you suddenly take away, a form of social support, a form of bonding and connecting, that is quite stressful. Adults, older adults, they probably by the time they reach a certain age, they have experienced periods of greater social isolation, or they're not quite necessarily as interconnected with others and seeing friends every day or talking to friends every day. But if you're 16, you're probably interacting with a lot of other kids. Now you can say, but wait a minute, we have the phone, we have the smartphones, you have all these digital tools, but it's not necessarily the same thing as the physical presence, the hanging out, the playing sports together. If you think about, for example, sports are a way of actually helping us with mental health. Practicing sports can help us with anxiety, physical activity has been shown to reduce depressive symptoms. So many kids probably are using sports and physical activities as a way of keeping their mental health in good shape. You take that away, say, no more contact sports. We're in the middle of a pandemic. You can't go to the gym. You can't do this. And you're creating an imbalance.
Mm-hmm. Yeah. And again, do you think in some ways COVID has helped to almost normalize mental health? I mean, there was such a stigma people didn't want to say anything. They didn't want to admit they were depressed or anxious. Has COVID had a positive effect in that way?
Well, there's no question that in some ways, we have a say in Mass General, no family goes untouched, meaning there's no family that has not been touched by mental health issues. But what COVID has done has tripled the number of family members with these problems, and therefore, in some ways, it has normalized, because now it's not just dad or one kid. It's now several people in the family that have felt this way, and that, to me, there's no question that it has normalized it within the family, where in some ways the distress now becomes something that people can share, and say, oh, well, I've been feeling this way too, I gotta say, and you kind of normalize it within your family, and then you normalize it with your friends, because, they may tell you, boy, this past 3 months, I've not been able to sleep, and I'm so anxious, and I feel down, etc. So we have seen that, and all this is great.
Yeah.
The problem is that then what do you do about it? Okay, I would like to see somebody. You make a few phone calls, and nobody has an opening.
Yeah.
Nobody can see you. So, and these challenges, what we say, the problem of access to care has become tremendous. So we at Mass General, we're trying to address the problem of access to care. We developed new team-based cares that increase the efficiency and our ability to turn around things. We tried to develop to leverage digital tools, group therapy. We're trying to do many things to improve access. But there are things that, unfortunately, are out of our hands. Like, for example, therapists, are often not allowed to practice out of state. So if you live in a state where the number of psychologists or psychiatrists is low, is lower per capita, you're not able to see a doctor from Mass General. Now, that to me makes no sense, because, if you have a shortage, and by the way, we have a tremendous shortage of clinicians.
Mm-hmm.
A few years ago, there was a study from the government to look at what's the difference between, what is the number of available psychologists and available psychiatrists, and what's the shortage? How many more do we need by the middle of this decade? And the projection was approximately 14,000 psychiatrists and over 50,000 psychologists. That was the shortage. Now, these estimates were made before COVID. So the real shortage is tremendous, because, you don't have enough clinicians.
So in essence, we have to triple it. Don't we have to triple it, given there's triple the amount of...
We need to have more trainees, and and then you find other rules and regulations, the same rules and regulations that say you cannot practice out of state. So you cannot save the life of someone who's suicidal in another state because, it's another state. You can't do that.
What would be the basis of that? It's not like there's state specific laws like there would be for the legal profession.
There are state-specific. It's a great question, Mark. There are state-specific licenses.
Right.
So they want you to have, if you're going to see a patient in, I don't know, in Illinois, you need to have a license in Illinois.
Right.
And
why wouldn't that be a national board that there's reciprocity from state to state?
This is exactly what we're struggling with right now, Mark. Absolutely. This is a major, major issue right now.
Because there's no differences in mental health from Connecticut to Colorado to Florida. It's mental health. It's not like there's a specific law that's different in each state that would affect the mental health of a person. That makes zero sense.
No, you're absolutely right. In fact, the Veterans Administration, the VA system, has full reciprocity. You can have a license anywhere in the state and you can practice in the VA. They figured that out. But for whatever reason, outside of the VA, you have to have a license in every state in which you practice or see patients, and this is the paradox, right? One of the silver linings of this pandemic is that we discovered that telemedicine works very well for psychiatry.
Right.
That you can see patients virtually and you can help them virtually. So what are the limitations? I could, in theory, see someone on the West Coast and provide care there, but the laws say, no, you can't do that because you don't have a license there. You can't do that. And so...
But they're coming to you, whether it's virtual or not. It's where you're sitting, right? If you're sitting in your office in Boston and they're coming virtually to you from California, aren't they coming to your practice in Massachusetts?
That's not how regulators see it. They say you are virtually going to California and prescribing medicines in California.
Yeah.
You're practicing in California. And so the question is, why do we have these rules and regulations in the midst of a crisis?
Right.
In the midst of, shouldn't we, in the context of the pandemic within the pandemic, should we say that in mental health, we have full reciprocity of all licenses across the United States, so that if I want to help and save a life in California, I can do that. Or in Texas or in Oklahoma, there's no reason to create this barrier. But that's one barrier. I'll give you another barrier. We have terrific trainees. We have, psychology interns and postdocs. They're very experienced. They can provide terrific therapy. Most insurance companies do not reimburse therapy provided by trainees. And to me, that means, so if you're a trainee, you cannot bill, you cannot, so that affects access. And it doesn't make any sense to me, again, in the context of, now, some insurance companies are very illuminated, have started to recognize that. So we have a couple of insurance companies that have done that. And I'm thrilled. But many of them continue to say, you're a trainee, cannot bill, for your services because you're a trainee. And that doesn't make sense to me.
So not only is there a limited resource, but we are now restricting access to that resource. I'm so glad you brought this up, Maurizio, because I actually was speaking to Senator Markey's team, our state senator, about this. about 3 or 4 weeks ago, trying to see whether we could at least get an exemption for college age kids. Because if a college kid has a therapist and a prescriber in Boston, in Massachusetts, and they go to college in Rhode Island, unless I'm licensed in Rhode Island, can't really see them. But what's fascinating is none of this would have mattered, I don't think, if it wasn't for tele. And we now have this absolute way to break down the geographic boundary. We have this remarkable telepsychiatry. And I honestly think part of, this is very negative on my part, I'm not usually this negative, but I think the insurance companies realized that telepsychiatry in particular was going to be great, that it would break down these geographical barriers. In our outpatient programs at Riverside, the no-show rate has gone from like 30 to 35% to maybe 2%. I mean, people just show up because they can.
Well, think about how more efficient you can be too, and how many more patients you can actually see, which is going to cost the insurance company that much more money, right?
Right. But you know what's really sort of baffling to me? I can actually be in California, but if I'm licensed in Massachusetts, I can see patients in Massachusetts, even though I'm in California. Am I missing something here, Dr. Fava? I think that's the law.
Right. Fundamentally, it's again, the regulations are there to ensure that where you're practicing, where you're prescribing medicines, etc., you have a license, a state license. The question is, why not having a federal license? Why not having a single license or full reciprocity, so that, like for example, in the European Union, you can, with an Italian license, you can practice in France, or, there is reciprocity across European states.
Yeah.
But, it's fascinating to me that in this crisis, we have not seen a move to really eliminate these barriers. There is a third barrier that is affecting access, and that one is of reimbursements. In Massachusetts, for example, the same billing code, the same type of visit done by a primary care doctor, same visit done by a psychiatrist, is reimbursed 60 cents on the dollar compared to the primary care doctor. So what you're doing here basically is sending a message that mental health care is less valuable, because the same procedure is reimbursed at the lower level. And so even though when we say that, that we have parity in mental health, we don't have parity when it comes to reimbursements. What does that do then to the problem of access? Is that hospitals that provide care, mental health care, find themselves losing money or having, financial losses in delivering care, because to pay the doctors, their reimbursements are inadequate to compensate the doctors. And therefore, in many places, there was a decision, well, if we cannot be paid for what we do, we're not going to really grow our psychiatric service. We're not going to grow it because we're losing money on it. Now, we're very fortunate at Mass General that the hospital, despite the financial constraints, has decided to continue to grow psychiatry. From 1934, when it was first established as one of the first psychiatry departments in a general hospital. And we've gone from, a dozen of people, in the general hospital. We now have 700 faculty members at Mass General. So We have a huge department, and we're very grateful for the support that Mass General has provided to our department. But there are many places around the country where they were not so fortunate. They gradually trimmed down and their psychiatry departments because the reimbursements were, grossly inadequate. So that's the other thing that we ought to see is true parity. Mm-hmm. Compensating doctors for the visits the same way that they're compensating another specialist or a primary care doctor. That by itself will improve access.
Also improve recruitment. I mean, if we're not getting compensated, why would people come into our field? So that's going to also help with recruitment. I, again, could not agree more. It is one of the most silly, frustrating things, and it is a subtle way, sometimes not so subtle, of saying that your mental health doesn't matter. At least we're calling it mental health now, more than mental illness, but it's still saying it didn't matter. Why do you think there was such a barrier? Why was there such a stigma to begin with? Why was this dismissed in human beings?
Well, I think that, if you think about it, there's, for decades, for centuries, there's been a stigma, shame, guilt, and rather than kind of saying to ourselves, this is an illness like any other illness, no different from diabetes or high blood pressure. We have, for whatever reason, stigmatized this condition, and therefore also created, the so-called carve-outs to have the insurance reimbursement not being part of the general reimbursement, but being carved out to companies that would then, quote unquote, manage this aspect as if it was not part of the person. It was some sort of an appendix, and you had to someone else had to manage that, from an insurance standpoint. All these things reflect, in my mind, the stigma and the fact that there's been discrimination in payments, in how mental health has been viewed, and how we have dealt with it. So a silver lining of the pandemic within the pandemic is that now people realize this is really important.
Yeah.
This is, we have over 40,000 suicides each year in the United States. We have over 70,000 lethal overdoses each year in the United States. And one could argue that also, in addition to suicides and overdoses, that, road rages and manifestations of behavioral discontrol are appearing very commonly now. And so it's a reminder of the importance of mental health, helping people to feel more balanced, more in control. And so I'm hoping that we're going to see changes. But we've clearly encountered significant barriers to providing care within the country.
Yeah. It is, I think, such an important question to try to speculate on. Where did this stigma come from? And, one of the ideas is it has to do with trust. If you can't anticipate the behavior of someone because they're depressed or psychotic or rageful, we mistrust them. And that mistrust is a devaluation. And when you devalue someone, they feel disrespected. For me, it all comes down to respect. For me, in my role as a psychiatrist, what I find is every person who comes to me on some level feels less valuable. And all I want to do is remind them of their value. And when I remind them of their value, that then leads to trust, and they can begin really exploring who they are and why they do what they do. We now have this globally, where, as you point out, so many people are now recognizing that this is part of the spectrum of who we are as human beings. Not everybody may get depressed, but everybody's felt sad. Not everybody may have a panic attack, but everybody's felt worried. And not everybody may get psychotic, but everybody has thought somebody was saying something about them at some point. So I hope that the pandemic has normalized mental health. So it's just part of who we are. Do you think that could have an impact?
Yeah, no, there's no question that we're starting to see kind of an improvement in how mental health is perceived. There's no question about it, and I think this is very positive. What we're doing to then address the access problem, that's something that we have collectively as a society do. We have to increase the number of trainees. We have to leverage digital health tools. We have to leverage paraprofessionals that could learn the basic techniques to help to deliver therapy and so forth. So we need to be creative and responsive to the crisis. And I think that we'll get there, but we also need regulatory changes, legislative changes, insurance changes to truly address the problem.
Yeah. Well, it seems like a heavy lift in some ways, but on the other hand, it's so important, so necessary, and so timely.
One thing I wanted to ask Dr. Fava about, if I may, is are we seeing some effects of people coming from COVID back to normalcy, right? Back to the pre-COVID? Have they created a cocoon that is making it challenging to come out of?
Mark, that's a great question because, there's no question in my mind that COVID's social isolation has actually, in some ways, reinforced fears of social interactions for those with social anxiety. If you suffer from social anxiety yourself, the COVID-19 has actually been aligned with your fears, right? So you felt actually comfortable limiting your social interactions and so forth. And, in general, we overcome fears through exposure and response prevention. So by exposing ourselves to what we're afraid of and preventing ourselves from walking away, from avoiding it. So if I'm, let's say that I'm an 18-year-old kid and I'm going on a freshman in college, and I was like very scared of being, in classes and interacting, but, now it's all virtual. I see my classmates, and I kind of got comfortable with being in a class because, it's all on Zoom and then the classes resume and I have to go in person, and now I have to be with people, and now I have to speak up in between classes, and now I'm very rusty. Now my social anxiety is really growing because I really I'm getting concerned. I don't know if I'm saying the right thing, etc. The fundamental principle is that if you don't use it, you lose it, right? If you don't use social skills, you tend to lose them. And if you don't expose yourself to what you're afraid of, which could be social situations, you become even more afraid. And so there's no question that for some people, restoring social activities will have a mood elevating effect. Will, for those who like the interaction, this is great. This is exactly, this can have antidepressant effects, being together with other people. But those with social anxiety who have been in this kind of isolated lockdown, they may be significantly more anxious than they were before the pandemic.
Mark, are you finding that's happening as you begin having your own social milieu?
I feel like it is happening to a certain extent when it comes to networking, right? So in the business context, people get together to socially network, right? To work together, and a lot of times it's done on an after-hours social, and it seems like it's really kind of slow to gain traction, and I can see that the numbers are still down, and when folks actually do come, there's still an awkwardness, and it could be in my head, or it could be I haven't seen this person in the flesh for 2 years, but it seems like there's something absolutely amiss with the connection that was once there.
Certainly makes sense to me, and that that in some cases that would be true. But as I said, there's also the other side of it is that some people are really being craving for it, and they finally get to be with other people and socialize.
I think especially with adolescents, because from my point of view, an adolescent wants three things. They want to be social, feel pleasure, and take risks. And right now with COVID sort of on the wane, but maybe not, they can do all three at the same time just by hanging out. They can be social, feel pleasure, and maybe take a little risk here and there. So that's the adolescent brain. And yet they got so depressed, these kids. Does this change? I know we've got a lot to talk about, but does it change the intervention at all? I mean, are we going to see more use of antidepressants, or is this going to be affected by more change in the social domain?
We know that depression can respond to antidepressants, but can also respond to talking therapies. And we know that even certain digital interventions that utilize cognitive behavioral therapy can be effective as well. So I think that, there's a range of options for people as long as they have access to those treatments.
Mm-hmm. And is there something that maybe within a family that the family can do for each other that may not have a trained professional?
I think that, the importance of having dinner together, of having social times within the family, I think is very important. Having, one kid that goes and eats by himself or herself, and another time, and another, that reinforces the lockdown mentality. So I think that there's no question that there is a terrific psychologist at Mass General, whose name is Anne Fischel, who has emphasized the importance of kind of the dinner together.
It's funny, when we ran, I had a program called Castle, Adolescent Substance Use, and we did just that. We had kids learn how to cook a meal together. We had a French chef come in, and they cooked it together, and then they ate the food and shared it, and it was absolutely remarkable. Dr. Fava, the show, Dr. Joe Show, has a lot to do with the I am approach, the idea that no one's broken, we're all doing the best we can at every moment in time with the potential to change, influenced by 4 domains: our home domain, the social domain, the biological domain, and what I call the I see, how I see myself, how I think other people see me. Because those four domains interconnect, a small change in any domain can have a big effect. We don't need to change everything. What small change can you recommend to our listeners to help them as they come out of the pandemic?
Well, I think that a critical change that we all need to focus on is that of trying to take care of ourselves in small ways, whether it's taking a break during the day and, walking, around the neighborhood, whether it's talking to a friend, having times for ourselves that feel nourishing, I think is absolutely critical. Sometimes we get so caught up with the need to do things and that we don't have those moments of peace or connectedness that feel like a nourishment to ourselves. So I think that it's very important that we all think, what can I do today that feels like a nourishment, a mental nourishment? And, pick anything that will do that. Play the piano, talk to a friend, whatever works for you. There is no universal approach to this. It's a personalized approach. Whatever works for you, I think, do something every day that feels like you're doing something for yourself to nourish yourself mentally.
Yeah, that fits so with the I am, because, once you remember that you are valuable, respect yourself, value yourself, absolutely, you can begin to nourish yourself as well. And boy, we really need to do that right now. You've been through a lot. The other truth of the I am, everyone has one. Everyone is interested in what you think or feel about them, which has an effect on their biological domain, because it feels differently when you feel respected or disrespected. And you're part of someone's or home or social domain. So what this means is you control no one, you influence everyone. You get to choose the kind of influence you want to be. Dr. Fava, psychiatrist in chief at Mass General. What kind of influence do you want to be?
Well, I hope that one of the things that I like to influence is the view of what mental health and mental illness is. Not something that is sort of a fault or a weakness, but something that we can all have. Something that we should embrace as part of us and feel comfortable discussing, addressing, and sharing with others. If I can, I would like to see more of that, more of kind of openness and open recognition. I think that the pandemic has certainly helped, but we're not quite there yet. We still have people who may be suffering a great deal and just try to hide it because they see that that there is something wrong with them in even admitting that they're suffering.
Yeah. We hope they all come out of the shadows, because we are here. Dr. Fava, thank you so much for your time and for your wisdom.
My pleasure. Thank you.
Bye. Bye, everyone. We'll see you next week on The Dr. Joe Show. Thanks, Larry.